Ayon sa World Health Organization, ang breast cancer ay pangalawa sa most common cancer sa buong mundo. Dito sa Pilipinas, sa lahat ng uri ng cancer, ang breast cancer ang #1 killer. Isang organisasyon ang itinayo para sa mga may breast cancer at ito ang Philippine Foundation for Breast Care. Ito ay isang non-profit at non-government volunteer-based service organization at ilan sa mga volunteers nila ay mismong mga breast cancer patients, breast cancer survivors, healthcare professionals at maging non-healthcare professionals. Ang layunin ng organisasyong ito ay maagapan at malunasan ng sakit na cancer. Kaugnay nito, nagsagawa ng Barangay Caravan Laban sa breast cancer ang C-Network at ang Kasuso Foundation sa 3 barangay sa Timog, Metro Manila. Ito ay sa Muntinlupa, Las Pinas at Paranaque. Sa mga lugar na ito ay namahagi sila ng leaflets at nagbigay impormasyon sa pamamagitan ng mga pocket seminars tungkol sa mga pamamaraan upang ma-detect ang breast cancer.
Ang Barangay Caravan ng C-Network, ang goal niya is for early dissemination at saka information sa mga barangay health workers para ma-empower yung barangay health workers sa pag-diagnose ng maaga, sa pag-pick up ng maaga ng mga, sa ngayon ng breast cancer.
Maraming mga hakbang para malaman kung may bukol ang suso. Maaaring umugnay sa doktor o espesyalista. Maaari rin magpunta sa mga health seminar sa mga kalapit na barangay para sa mas masuring kaalaman. Kung ma-diagnose natin ng mas maaga, malaki ang tsansa na mapagaling pa mula sa cancer. Ako si Jinky Perlustica at APRUB sa amin ang organisasyong ito.
Kanina sa ating intro, sabi ko, our episode today has a story of hope dahil kasama natin yung isa sa mga cancer survivors at ngayon ay active in her way, in her respective way sa pagkakampanya tungkol sa information dissemination ng breast cancer. Please join me in welcoming Dr. Esther Oliveros, Las Piñas City Health Officer at siya ay isang cancer survivor. Ma'am, magandang hapon.
Magandang hapon po.
Kamusta po kayo?
Mabuti po.
Ang ganda-ganda ng smile nyo.
I am well and healed.
And healed. Okay. Now, unahin muna natin, you're also a medical practitioner. You were a medical practitioner.
Yes.
Okay, but now you are in government.
Yes.
Okay, as?
City Health Officer of Las Piñas City.
Okay, so may kinalaman pa rin sa medisina pero hindi na katulad ng dati.
More on administrative na po kasi.
Right.
Yeah.
But before you went to government, ano po ang specialization ninyo, ma'am?
I had my internal medicine, pulmonary section sa Veterans Memorial Medical Center.
Okay, now let's go to the other aspect of why you are here. Congratulations first of all sa inyo at saka sa mga doktor ninyo because you beat cancer. What kind of cancer did you have?
I had my breast cancer.
Breast cancer, okay. And you were diagnosed at stage what?
Stage 2,
Stage 2.
last August of 2010.
2010. So recently lang, fairly
Yes.
recent lang siya. Okay. Could you explain to us, sa ating mga viewers, yung kung ano ba yung stage 1, kung ano ba yung stage 2, kung ano ba yung stage 3, meron pang stage 3B, tapos meron pang stage 4. Could you explain
Yes.
to us, ma'am?
I'm not so familiar, but I think stage 1, the stages depends on the size.
Right.
And like me, I am stage 2 with no involvement in any lymphatic system.
It hasn't spread.
Yes.
Okay. Tapos, how were you diagnosed? Did you feel any symptom?
No, nothing at all.
Nothing at all.
Yeah.
We would like to emphasize that, no? Kasi
Yeah.
doon yung lundo nitong ating discussion
Yes.
ngayon. You may not display or exhibit any symptom. But how were you diagnosed then?
Yeah, it just happened.
Okay.
When I had my massage, I wiped my body with the lotion, and then suddenly I was able to palpate
Right.
a hard mass.
Right.
Because it's so deep, I cannot imagine if it's big or small. So immediately after one day, I went to our clinic for ultrasound.
Right. Okay.
And then I got already the result right away, and then they cannot rule out malignancy.
Okay.
The following day, I went to my doctor, And he suggested several examinations, especially the fine needle biopsy.
Okay.
And the sad part of this is, like any other breast cancer patients, the acceptance.
Of course, of course.
Yes.
Ah,
But as a doctor,
Yes.
I really understand, what is cancer.
Yeah, you were talking kanina about palpation, ano, yun yung
Yes,
pagsalat,
yes.
and you are a doctor. But what we would like to emphasize here, because of what C Network has been doing and the affiliates of C Network, kahit hindi ka doktor, kaibigan, pwedeng ituro sa'yo kung papaano mo pwedeng i-diagnose ang sarili mo. Si doktora, walang problema. May training siya talaga. At incidental lang yung pagka-discover niya. But for women, kinakailangan alam natin itong lahat. Okay?
Yes.
If you don't mind, doktora, you were how young when you were diagnosed in 2010?
Yes, I was 64 years old.
64 years old. And you are now
I will
26.
be going 66 this December.
Wow, advance happy birthday. And because of early detection, early diagnosis, you are going to celebrate your birthday on December.
Yes, of course.
Okay.
With the blessings of the Lord.
Of course. Could you tell us, ma'am, kasi hindi siya pangkaraniwang bagay para sa isang babae, no? Lalo na yung mga kabataan, na magkaroon ng self-diagnosis, yung pagsalat sa dibdib. Gaano ka-importante ito considering everything else? Kung gaano ka-prevalent ang breast cancer, kung gaano siya ka-deadly in some instances pagka late na. Could you tell us, ma'am?
Kasi talagang importante po na magkaroon tayo ng proper examination ng breast natin.
The word is proper.
Yeah.
Okay.
And I mean, after, especially for young girls, they have to examine their breast or about 10 days after their menstruation.
Right, okay. When we talk of young girls, how young exactly?
Maybe as early as 20 years old.
20
because
years old.
there are cases of breast cancer as 20 years old.
Okay. And may limit ba ito? For example, meron bang certain age na medyo immune ka na sa breast cancer?
Wala.
Wala.
Hanggang buhay, ang babae ay pwedeng magkaroon ng cancer.
Okay. Now, let's set aside you being a doctor, no? Halimbawa, hindi ka doktora. How easy is it to learn the steps? Ito kasi yung ipinamamalakaya ng C Network at saka yung mga affiliate organizations and associations. Is it really hard? Is it too technical to learn it?
Not really.
Okay.
Kasi if I'm not a doctor, maybe it's also, it's hard also for ordinary women na to become routine for them to examine their breast.
Okay.
Even if maybe doctors or those are educated women, because they are busy, in the family, especially in the indigent sector, they are busy in something else,
Right.
except for their health.
Right.
Because according to survey, when we had our survey, health is not a priority in our lives.
Right, right. Especially yung madaling i-deny, kumbaga.
Oh, yeah, oo.
Cancer, yan, hindi ako niyan tatama. Ibang tao, pero ako hindi.
Natatakot.
Yeah,
oo.
yeah.
Yun nga yung sinasabi ko kanina na if you are diagnosed with cancer, the acceptance.
Right, right.
In
Could you
yourself.
tell me more about that? Kasi you were a doctor, no? Tapos you were able to detect it. Di pa na-diagnose na, salat mo lang, aksidente pa.
Yes,
You were
yes.
able to detect it, and then because of your training, probably in your education, mas madali sa'yo na magpatingin sa doktor. But as a woman, like any other, how did it hit you?
Kasi nga, siyempre, di ba, meron tayong mga breast cancer program. So, inaano ko kasi, mayroon akong mass. I have to go to the doctor for immediate, assessment, evaluation, and immediate treatment.
Right.
So, kung sa ordinary pong mga kababaihan, siguro mas maganda na pumunta agad sila sa pinakamalapit na lang health center or private doctor for assessment.
Right.
And para ma-work up po agad sila. Kasi yun po ang nagkakaroon ng problema. Kung minsan matagal yung work up. Siyempre, pupunta ka sa doktor, baka may problema ka sa finances.
Right.
So, hindi ka agad makapagpa-check up.
Okay.
So, once na na-check up kayo, iisipin mo naman, naku, meron akong ganitong sakit. Paano ng aking family? Paano ng aming finances? So, yun po yung mga primary considerations, kaya nagkakaroon ng delay in the management of breast cancer.
In actually acting on it.
Yeah.
Okay. Now, let's go back dun sa sinabi ninyo that you were diagnosed at stage 2. Ito rin ang ini-emphasize ng C-Network, no? Kaya meron silang ino-offer na free consultation, and in some instances, kung talagang hindi kaya magpa-mammogram, nagbibigay din sila depende sa urgency ng need. Now, stage 2. Kasi pag sinabi pa rin natin cancer ngayon, medyo nakakatakot pa rin
Oo,
siya.
kahit anong stage.
Yes, ma'am.
Oo.
Now, I would like for you to tell us na kung ano yung big difference nang na-diagnose ka ng stage 2 as against stage 3 and stage 4.
Kasi yung pong, kunyari, stage 1 maliit pa. Yung stage 2, 2 cm and below.
Okay.
At 2 cm and above.
Okay.
Pag po naman stage 3, 3 cm and, gano'n. Tapos, meron na po silang mga involvement. O kaya pag stage 4, meron na mga metastasis in other organs.
Ibig sabihin na metastasis,
Kumalat na po yan.
cancer cells. Okay.
So, iba na po ang treatment doon.
Okay.
Mas aggressive na ang treatment nila.
Okay. Before I introduced you, I said this segment is about hope, no? You being a doctor yourself and beating cancer. Baka meron kang gustong sabihin sa ating mga audience, no? Kasi everybody here is concerned. Basta kayo meron kayo mahal na babae, nanay nyo, kapatid nyo, asawa ninyo, anak ninyo, you should listen. At lalo na kung babae ka. Let's hear Dr. Esther.
Kaya ang advice ko po sa mga kababaihan, kayo po ay talagang matuto ngayong mag-examine ng inyong mga suso. Kasi ang breast cancer po ngayon ay number 1 na, ang incidence. Na-overtaken na po ang lung cancer.
Right.
So, kung mahal po ninyo ang inyong family, ang inyong mga anak, magpa-examine po agad tayo, magpunta sa doktor, at humingi po ng tulong sa lahat po ng ating mga kamag-anak o kung sino para po tayo ay maagapan ang pagpapagamot. Kasi ang pinakamaganda pong, kahit ano pong sakit, kailangan ay maaga ang pagpapagamot para po madali ang paggagamutan, para madaling gumaling.
Okay. That's the voice of the doctor in you. Now, I'd like to hear the voice of the cancer survivor in you. How does it feel like to know that you triumphed over cancer?
First of all, this is a blessing from the Lord. Ang sabi ko nga po, any trials in our life is a blessing from the Lord. Na kung ano yung bigay niya sa atin, kaya nating tanggapin. At in every journey, in every trials, let's offer everything to the Lord.
Okay.
Kasi siya po ang nagbigay sa atin ito at hindi po tayo niya pababayaan.
Okay.
Sabi ko nga dun sa message ko, ang sabi po ni Lord, leave everything to me and all things will be well.
And He sends tools
Yes.
to your aid, and these are your doctors. You may name them if you want to.
Yes, of course. I would like to thank my surgeon, Dr. Jojo Arcilia, from Manila Doctors Hospital, my medical oncologist, Dr. Jerry Cornelio, and my radiologist, Dr. Magsanok from St. Luke's Global Medical Center.
Okay. So, if you were talking to some people who have suspicions na baka may cancer ako or na-diagnose na may cancer, what would you tell them?
First of all, yun nga po sabi ko sa kanila, yung naandyan po yung support ng kanilang family, kung kayo nagtatrabaho, naandun po yung mga support ng coworkers, and prayers. Yun po ang kailangan natin parati. Prayers from our friends, from our families, para po naandun. Kasi nung pong magkaroon ako ng sakit, lalo po kami naging close as family.
Right. Okay. And of course, I would also congratulate you because ang tingin ko sa lahat ng mga taong nag-survive sa cancer are fighters. So, congratulations for being a
Yes.
fighter, ma'am.
Thank you po.
Okay.
I would like also to thank our mayor from the Las Piñas City, Mayor Berhel Aguilar and Mrs. Imelda Aguilar, for the
Yun.
support and understanding when I was sick.
Right. Ang
Thank
mga
you.
boss ni Doktora, because she is the Las Piñas City Health Officer, mga kaibigan, ang nakasama natin, Dr. Esther Oliveros, a doctor, but also a cancer survivor. Magbabalik pa rin ang APRUB.